Hello, today we will be discussing antidiuretic hormone and antidiuretic hormone analogs. So the actions of vasopressin are twofold. First is to retain water in the body, and by retaining water in the body, it causes an increase in volume in the vasculature and an increase in blood pressure, and also a decrease in the osmolality of blood. Second, it constricts blood vessels. For retention for water in the body, there are several mechanisms by which antidiuretic hormone does this. One, it increases the reabsorption of water from the collecting duct. And again, reabsorption of water into the systemic circulation is going to increase the volume of what's in the blood vessels and therefore increase blood pressure. This also functions to concentrate urine. So if you think about the anatomy of the nephron, the collecting duct is the last part of the nephron, so that's the last step in the formation of urine before it leads into the ureters. So by reabsorbing more water from the collecting duct, that's going to concentrate urine to a greater extent. In addition, antidiuretic hormone increases the permeability of the collecting duct to urea. And finally, it increases sodium reabsorption from the loop of Henle. Water follows sodium, so that's going to increase the reabsorption of water into the systemic circulation, much as what is done in the collecting duct. However, the degree of the water reabsorption in the loop of Henle is less than what occurs in the collecting duct. However, this does contribute to the decreased excretion of water or the increased reabsorption of water overall. For constriction of blood vessels, antidiuretic hormone achieves this by increasing the peripheral vascular resistance of blood vessels. And again, this also functions to increase blood pressure. So there are a few drugs in this class. One is vasopressin, and it actually is antidiuretic hormone. And then we have the antidiuretic hormone analogs. Those are desmopressin, lipressin, and terlipressin. Desmopressin is predominantly the drug of choice in this class. However, there are some unique uses of these other agents. We'll start with vasopressin. Vasopressin can be administered two different ways. It can be intranasally or IV. Some sources say that there is only IV products available, while other sources say that there is IV and intranasal products available. The reason there are no oral products is because that vasopressin is inactivated orally by trypsin. So trypsin that is present in the GI tract would rapidly degrade vasopressin and prevent it from having any absorption and therefore any effect. The indications for vasopressin are shock and vasodilation. Thinking back again to the mechanism that the vasopressin acts to increase that water reabsorption and therefore increase the volume of blood, and therefore that's going to help with the presence of any type of vasodilation or profound vasodilation that's occurring. Also, diabetes insipidus. So diabetes insipidus causes an increased production of urine. So vasopressin acts to counteract this by concentrating urine to a greater degree and therefore decreasing the amount of urination by the patient.